Thank you. Hello, thank you. Hello, everybody. Thank you for having me today. So my name's Katherine Young. I work for the Macular Society, and I'm the regional manager in the Northeast, and I cover up to Berwick and down to Teesside. So it's quite a large region. I'm based in Cullercoats in the middle, so it's not too bad travel wise. And yeah, the Macular Society is it's a national charity supporting all of the UK, and there's equivalents of myself all over throughout Northern Ireland, Wales, England, and Scotland. And we're here to support everyone with a macular condition. Our aim is to beat macular disease, and we do this by funding world-class research and providing information and support. So today I'm going to take you through a few things, a brief history about our society, and then a little bit about the condition itself. Treatments are available, some of the examples of the research we fund, and then more about the support side as well, about support that can be offered to you in Northumberland and throughout the UK, and some stuff we have nationally as well. Okay. So just a brief history about our charity. So our founder, um, excuse me, sorry, one moment. Our founder was Elizabeth Thomas, and she founded the society in 1987. And she herself had macular disease, and she was dismayed by the lack of support that she and other people were offered. And sadly, that's not dissimilar to the experiences I hear these days as well, unfortunately. But she founded the Macular Disease Society, as it was known at the time, to help patients like her support each other. So in 1990, the society then started funding research too. And in the first few years, funding averaged at about £8,000 a year. And then our counselling service was then set up in about 1999. And since then, it's helped many thousands of people struggling with sight loss to see a more hopeful future. And then by 2013, we were spending more than about £500,000 on research. And then we had a new name called the Macular Society. So some people may have heard or may still think of it as the Macular Disease Society, but most people now know us as the Macular Society. And then present day, our helpline has answered 18,000 calls and emails from people struggling with macular disease. We have more than 400 local support groups across the UK. We have a few in Northumberland, which I can tell you about in a bit. And these have provided friendship, information, a sympathetic ear to chat to thousands of our members. And we have more than 1,200 volunteers too. And these help support our local support groups too. And in terms of research, recently we've invested more than 1.2 million in groundbreaking new research. People always like to know about the research part of our charity too. They're always interested in new emerging treatments, and part of my role is spreading that word and answering any questions that people have about this. And this is as part of a combined 3.8 million in ongoing research projects. So just to talk a little bit about the condition itself, in terms of numbers affected, nearly 1.5 million people in the UK have macular disease of all types. 2.5 million people have sight loss in the UK, so it is the biggest form of sight loss, and around 300 people are diagnosed every day. It can affect people of all ages, but age-related macular degeneration, which you may have heard of, or AMD, as it's most commonly known, is the more common condition, and it generally affects people over the age of 55. AMD is the biggest cause of sight loss in the UK, and this affects more than 700,000 people. But there are also other types of macular disease. A group of rare inherited conditions called macular dystrophies can affect much younger people. You may have heard of one called Stargardt disease. This can appear in childhood. In some rarer ones, it can affect much younger people. And although some are not diagnosed until later in life. And then the macula itself, just a brief description of it. So the macula, it's part of the retina at the back of the eye, and it's about the size of a grain of rice. And this is responsible for our central vision. So most of our colour vision and fine detail of what we see. It has a high concentration of photoreceptor cells. So these cells detect the light, detect light, and they send signals to the brain, which then processes them as images. And the rest of the retina processes our peripheral or side vision, which is what a lot of people with macular conditions that attain their peripheral or side vision. And then many macular conditions, again, with the juvenile form, Stargardt or Best dystrophy, excuse me, I have a little bit of a cough today, or Cohen dystrophy. There are many forms of these types as well. But to just talk about, again, age-related AMD, this usually affects people over 50, but it can happen earlier. The older we are, the greater the risk of developing the condition. And there are two main forms, which you may be familiar with or have yourself. There's dry, and this is the gradual deterioration of the macula. And this is as the retina cells die off, they're not renewed. The term dry is used to indicate that it's not wet, basically. It's just to distinguish between the two. Progression on this varies. The thing about sight loss and the thing about macular conditions is there's no one size fits all. What happens to somebody else in terms of symptoms, in terms of progression, or how, the speed of it can vary greatly. But in most people with dry macula, it's over many, many months or years. Often people can carry on as normal for some time, and currently there's no treatment for dry. And then we also have something called wet macular degeneration, and this develops when abnormal blood vessels grow into the macula. They leak fluid or blood, which can lead to scarring of the macula, and then this causes rapid loss of central vision. It can develop very suddenly, and this can be very scary if it happens to people. There is a treatment for wet with injections of drugs into the eye to stop the growth of these abnormal blood vessels. So these injections are assessed and to see if more are required after 3 initial loading doses. The eyes are anesthetized and the needle goes into the corner, so you don't see it. But again, it's not the nicest or most pleasant experience for people in my experience from speaking to people who have this. Some may be offered laser treatment if they don't respond to injections, but in my experience, I haven't come across this very much. So in terms of a diagnosis, the optometrist at your local optician's practice will test your sight. They can test sight, prescribe glasses, and check for eye disease. Some optometrists use photography or other imaging to detect early signs of macular degeneration. These might include an OCT scan, which create cross-sectional images of the retina, and you may be charged for these tests. And then wet and dry related macular degeneration, just to talk a little bit about that again. So after your diagnosis, like we've said, there is currently no treatment for dry AMD, so you might not be referred upon diagnosis to the hospital for that, unless confirmation of a diagnosis is required, or your optometrist thinks you need a hospital low vision service. And a low vision service might be an assessment for, they can make the best use of your vision with magnifiers, or you might be able to test your visual acuity with that. But if your sight has worsened and you would like to be registered as sight impaired, you will need a hospital appointment. If your optometrist suspects you have wet AMD, you should be referred to a retinal specialist at a hospital directly, and you'll be seen within 1 to 2 weeks. If applicable, you should be treated within 2 weeks after initial identification. That is the ideal. That isn't what always happens, but that's what we're aiming for. And you should not be sent to your GP because this causes unnecessary delay. And then hospital tests. If you are referred for hospital tests, further tests will confirm the diagnosis, and the specialist may use eye drops to dilate your pupils to see the back of your eye. These might make your vision blurred and sensitive for a short amount of time. An OCT scan, and these can detect the early signs of retinal conditions and diseases. And then also there's one where you can have a dye injected into a vein in your arm, and it travels to the eye and it highlights the blood vessels in the retina so they can be photographed. And the dye will temporarily change the colour of your urine, so be prepared for that one. They can also do genetic testing. So if it's suspected you have a macular dystrophy, so this is sort of an inherited macular condition, for example, like Stargardt's, you might be offered a genetic test, and a genetic test usually involves having a blood sample taken, and then the DNA is extracted from blood cells and analysed in the lab. The analysis involves looking very carefully at a genetic code to try and identify the genetic alteration that is causing the condition. Many people have the genetic cause identified, although it's not always possible. Excuse me, I'm just going to have a drink. So, what causes? We'll talk about the causes for a bit of AMD, so age-related. So the cause isn't known, but there are a number of factors associated with the condition. Age, so cell regeneration reduces as we get older. Genetics, family history can increase the chances. Smoking damages blood vessels in the eyes and often leaves you 4 times as likely to develop it. Diet, so poor diet, low in fruit and vegetables. I talk a lot about this, nutrition and eye health. Antioxidants protect the body against the effects of free radicals. Unstable molecules that damage cells or prevent cell repair. I'm going to talk a little bit about that in a bit, about, diet and how this can help. Blood pressure. So if you have high blood pressure, 1.5 times more likely to have AMD. And gender, it affects equally, really, but as women typically live longer, more women are diagnosed. And then symptoms to look out for, or that people experience. It affects everybody differently, and some symptoms may develop slowly if you have dry and it is only in one eye. As it progresses, the ability to see clearly changes. So people experience gaps or dark spots, especially first thing in the morning. Objects might change shape, size, or colour, or move or disappear. Colours fade. You can find bright light glaring and uncomfortable, or there's difficulty to adapt to light or dark environments, and words disappear that you are reading. And then straight lines, for example, a door frame may appear distorted or bent. People I speak to a lot describe often any lines of any frame, so a window frame, for example, appearing wavy. So that's some experiences. And then visual hallucinations can occur also as a result of sight loss. Up to half of all people with macular degeneration are thought to experience visual hallucinations at some time. When hallucinations happen as a result of sight loss, they are known as Charles Bonnet syndrome, or CBS. You may have heard of this. It's become a lot more prevalent, or people are recognizing it more and more these days as part of their sight loss. After the 18th century, Charles Bonnet syndrome was named after the 18th century Swiss scientist and philosopher who first described the condition. Charles Bonnet hallucinations are not a sign of mental illness, which a lot of people think they're experiencing when they experience these hallucinations. They often keep it to themselves at first. They're not sure what's happening to them. But now, because we're talking about it a lot more people are recognizing it as part of their condition and talking about it, which is great. These are more likely to occur if both eyes are affected by sight loss, but can occur with problems in one eye only. The hallucinations often start after a sudden worsening of vision. Again, these hallucinations, they're not a one-size-fits-all. Some people have them, some don't. Some have them regularly throughout the day. Some will experience them a couple of times, then not again. It can be quite tricky with Charles Bonnet, but again, it's not one size fits all. So reduction of risk, reducing the risk with AMD or other macular conditions, nutrition and lifestyle. So you may have heard eye doctors talk about how important diet and lifestyle changes can be on reducing risk or slowing the progression of age-related macular degeneration. While there can be genetic factors involved, environmental factors also play an important role in determining the risk of AMD. So, for example, smoking. I think I touched on it earlier. Smoking can be really dangerous for your eyes as well as the rest of your body. Cigarettes contain many harmful chemicals which are released in the smoke and inhaled. These chemicals, called oxidants, can cause an increase in inflammation and damage to the cells in the eyes. And there's been a lot of research and acknowledgement that there is a big link between inflammation and AMD. This can seriously harm the cells in the retina, called the retinal pigment epithelium, RPE. And the RPE cells' main function is to keep those photoreceptors, the cells that sense vision, alive. If the RPE cells die or get damaged, it can cause the photoreceptors to die. So this is what leads to a loss of vision. So diet can play a role in not only lowering the risk of AMD, but slowing the progression. And I spend a lot of my time talking to people about their diets and why it's so important to eat fruits and vegetables, eat the rainbow. We always talk about fruits and vegetables, they contain nutrients with antioxidant properties to combat this. These work by stopping the dangerous oxidants, such as from cigarette smoke, from damaging the cells and causing the inflammation. Cigarette smoke is not the only form of oxidants. There's pollution, there's chemicals, UV light, and more may all cause, and all these may cause oxidation and inflammation. So it's important, the antioxidants for vision. So there's some important ones. They're lutein, zeaxanthin, vitamin C, and vitamin E. Lutein and zeaxanthin can be found in leafy green vegetables such as kale, spinach, red pepper, and eggs. I always tell people, eat your dark greens, eat your kale, eat your spinach, because they're so high in these antioxidants, and it's so clearly linked to the progression of AMD. So it's really, really important that you eat a healthy diet. And then other changes. There are other small changes you can make to better monitor your disease and any vision loss. These include having yearly optician appointments to monitor any changes in your vision. You may have heard of Amsler grids, and if anyone would like, I can send some examples of this on. These are small grids with lines vertically and horizontally. They can be very useful in quickly noticing any vision loss or distortion. If they are often given out with sight loss charities at hospitals to regularly monitor your vision, or opticians. If you notice any sudden differences using the Amsler grid, they could indicate that your AMD is progressing, or dry may have turned into wet, which it can do. So that's a little bit about prevention or slowing the progression. So I want to just talk a little bit before I talk about the sort of support we can be offered specifically in Northumberland or in the UK. I'll talk a bit about the research part of our charity and why it's so important. So essentially, our charity wants to beat the fear and isolation of macular disease. And we do this by funding research to find better and new treatments, and one day, hopefully, a cure, because currently there is no cure. So why is our research so important? Well, we have some treatment options, such as injections for wet AMD, but unfortunately for many macular conditions, there are no treatments. We are hoping that new techniques such as gene and stem cell therapy will soon lead to treatments to save the sight of everyone with macular disease. So our research project, since 1987, the Macular Society has invested around 10 million in over 100 research projects. Most of our projects are available to look up on our website if anyone wishes to. There's the active ones and completed ones too. And then how it works is each year we invite applications for research grants, PhD studentships, and seed corn grants, which are assessed by our research committee. So the grants offer projects of up to 3 years duration and up to £250,000, which covers everything from laboratory chemicals to salaries. And then the PhDs, we fund a student to undertake a 3-year research project, and the student submits a thesis for qualification of the degree, which is the highest level of academic degree attainable. And then lastly, we have what are called seed corn projects. And this is funding of up to £25,000 to generate preliminary data to advance innovative and novel ideas. So I mean, we have hundreds, but just to give you an idea of some examples of some active research currently underway. So we have one for an implantable eye lens for macular disease. So this would be having magnifying lenses that can be given to patients with macular disease. And this will be the first trial to see if they help. We currently have one for a blood test, so creating a blood test to detect early AMD. So researchers looking into a protein found in high levels in retinal cells of AMD disease patients, and this protein could be used for treatment or diagnosis. And then lastly, for DNA strands, so turning off faulty genes to treat macular dystrophies, the inherited conditions. So there's an awful lot going on, really. And then lastly, we have using technology to aid functional vision. So creating a new app to help those with central vision loss be able to use their smartphones and tablets better, quicker, and easier. There's an awful lot of information about this on our website. It's an accessible website. Please do have a look if you're able to. And it has an awful lot of information on the different research projects at the moment. And so just to talk very briefly about current treatments for wet. The current treatments for wet AMD are drugs called anti-VEGFs. Wet AMD is caused by an increased growth of the blood vessels in the back of the eye, with the blood vessels leaking fluid. The growth of the blood vessels, they damage the cells of the retina. So these drugs, they work by stopping the growth of new blood vessels and reducing the leakage. Those with wet AMD can usually get this treatment on the NHS. The NHS have approved a couple of drugs for this, and most patients require these injections around every 4 to 8 weeks. The reason I'm talking about these treatments and the timescale is because a lot of people I've spoken to in Northumberland, it can be a lot to travel for these appointments, and it's not always easy with the infrastructure and transport links, so it's not always easy, but research is looking at new drugs which need less frequent injections, and we hope these will be available soon to reduce the burden of frequent injections on both patients and eye clinics, because the number of people diagnosed with AMD is going up and up and up. And, the clinics I visit, for example, at the RVI, they're very, very busy places. Waiting times can be quite long. And people don't always have a good experience. They do sometimes, but it can vary very much. So the future of macular disease treatment. So the Macular Society, our charity, is dedicated to finding new treatments for all of those who have macular disease. And we also work with companies, pharmaceutical companies, providing insight into our members' wants and needs. So as I said, currently for dry AMD, there's no treatment available. However, the first drug used to treat geographic atrophy, or otherwise known as late stage dry AMD, it has been approved for use in the USA, and this will be administered through eye injections. However, the UK Medicines and Healthcare Regulatory Agency, they are reviewing it at the moment, the drug for licensing in the UK, not available yet. But my experience, and from people I speak to, and the charity's experience, many patients are told when they are diagnosed there is little to nothing to be done to stop the vision loss, and this is quite disheartening and distressing for patients. And this is where often they find our charity, or they come across our charity and they ring up for information, and they can be supported one-to-one or be referred out to other agencies or groups as well. But there are very promising clinical and research studies looking into new treatments for different types of macular disease at the moment. So just to talk a bit about how we help the supporter side of our charity, we are open to all affected by macular disease, including we support family, friends, and carers. We have a free advice and information service. You do not have to be a member of our society to access our services. They're all free. We have a specialist team down in Andover who provide free information on the phone, guidance and advice to anyone affected. And we do support family, friends and carers too. And this service is it's like a gateway to all the other services. And they're available and open from Monday to Friday, 9 to 5. And there's a telephone number you can ring, or an email, or our website is another way. And then we also have regional support. So that's myself. So I'm the regional manager up here. I always laugh and say I'm a service too. People will refer to me, and people can ring me for one-to-one chats. We can talk about local support available in your region. I run support groups, so we provide information and education on all things macular, but sometimes people just want to come for a cup of tea, for some emotional support, practical support, sharing coping strategies, social support and social outlets. In Northumberland at the moment, we have support groups in Alnwick, Morpeth. We're just opening one in Hexham in Corbridge next week. We have one in Berwick, and then we also have a North of England telephone support group, because we know a lot of people, particularly in Northumberland and Durham, for example, where it's quite rural, they don't have access, or they can't get to these physical face-to-face groups. So instead, the telephone group, we have 2 calls monthly, and that can be a lifeline for people too. We have speakers on, not always eye related, sight loss related. For example, in the past we've had Anna Gardens, for example, on to speak all sorts of nice things. And it's another way for people to connect. The support groups are great. They generally meet monthly, and they're run by volunteers and myself. They have speakers on. Anyone is welcome, and they're a really lovely way to sort of access support. And then my role, not only do I help with the support groups and speak to people one-to-one, I can support local members, and I work in partnership alongside other organisations throughout the North East. It might be local sight loss charities, for example, Vision Northumberland, BID Services, the council. I work with the ECLOs. You may have heard of this term. It's an eye clinic liaison officer. They're they're employed by the RNIB, but they work in all the hospitals throughout the North East, and they're sort of not quite social prescribing, but they sort of a signposting. So they will often, after people have had an appointment at the RVI with a doctor or a consultant, they'll be referred to the ECLO, who will then sort of signpost them out. And a lot of ECLOs refer to me. They'll ring me up and say, I have someone who's interested in groups or would like to speak to yourself about local support. So I will then give them a ring. But I work closely with lots of other charities as well in the North East. And I attend lots of other events as well, and just about raising awareness and getting our charity out there, getting it well known to people, because it really is a great service. And like I say, it's free. The charity also offers telephone counselling. We have a confidential telephone service with a trained counsellor, and that can often help people come to terms with a diagnosis, reduce anxiety, hopefully lift mood, and provide people with coping strategies, because it can be often the diagnosis is given at the opticians and it's a real shock. Some people can be told on the day they're not allowed to drive home, and that's very, very difficult too. And we offer the same service to that person's family members too, because quite often they're in need of support too. We also offer a telephone befriending service. So we'll have teams of volunteers, and they're paired to provide regular friendly phone calls to people who might feel isolated or want to talk to someone about their experience of macular disease. We also have telephone treatment buddies, and this is a volunteer telephone treatment buddy. They provide information and reassurance to people who are newly diagnosed or facing injections or treatments for the first time. We have skills for seeing training. So this is a one-to-one advice in person or over the telephone on how someone can make the most of their vision, their remaining vision. So it combines vision know-how, magnification, lighting, and it's about making the best of the vision you have. And where it works for some people, eccentric viewing you may have heard of, or steady eye strategy techniques can be gone through. And this is often using your peripheral vision, and it's very effective. And then we also have a Connect by Tech service, and this is one-to-one telephone support with a volunteer to help make the most of technology to aid daily living. And then we also support working age and young people too. The service supports working age young people and parents of children with macular disease. We have a working age group in the Northeast too that normally meets annually. It happens to be in a pub, but it's not always a pub. And then we normally meet annually and have some guest speakers on as well. And it's a really nice event that happens yearly. And then we have a mentoring service. So our volunteer mentors advise and offer support through their own personal experiences of macular disease. This can be very effective and important because people with newly diagnosed are often very scared. They don't know quite what's to come, and it can really help with practical tips or to speak to someone who has been through that experience. As a society as well, we hold annual conferences and webinars. We organise an annual conference, and every month we host various webinars, bringing people closer to our experts. And please check these out. We have webinars and our podcast, Macular and Me as well. Please check that out. It's on our website with short podcast episodes that are really useful. And also on our website, it's a wealth of information. We provide practical guides and other researchers as well, because it can often make it difficult to lead an independent life if you have macular disease. And so we provide information on various subjects on our website, and they're available in paper and audio formats too. Like I say, you don't have to be a member of our society to access our services, but if you want to, you can become a member. So in terms of our membership, we offer membership to the society for people that want to join for an annual fee of £22. But for this, you do get access to what's called our Side View magazine, which people love. And this a quarterly magazine, and it offers research updates, technology features, daily living tips, other stories. And it's and again, that's available in large print, audio, or a digital format. And then again, you'll get monthly email updates and invitations to our conferences as well. And lastly, you can as well, we also have a research participant database. There are many clinical trials and research studies looking at new treatments. So we are often approached by researchers to help find people willing to take part. And involvement can range from providing feedback on new developments to undergoing treatment as part of a clinical trial. So our research database is for anyone based in the UK. So if anyone would like information on that as well, I can pass that on. So that's mostly about our society and what we do. In terms of supporting people in Northumberland, I visit all over Northumberland and I speak to people one-to-one on the phone. I hear similar experiences from people in terms of travel, all sorts like that in terms of getting to appointments at the RVI or Cramlington. There is a satellite clinic at Cramlington that's quite difficult as well. So thank you for that today. If anyone has any questions, I'm just seeing any. Thank you, Laura. That's it from me in terms of what we can support and what we do.
Thank you. Thanks, Katherine. That's really, really great. There has been one question come in. Just to say, we will pass on information, sort of after this event. One of the reasons Katherine wasn't talking to slides is because it's not necessarily accessible to people with sight loss, but we will obviously make sure that you get information with the useful web links and things like that afterwards. So we've had a couple of questions. The first one, and apologies if I don't pronounce this correctly, but it's would you be able to support someone who has, is it angioid streaks and is at risk of AMD? The person's already blind in one eye and has limited sight in the other.
I would say we can support anyone, even if you have questions about you've been told you're at risk of AMD, please do get in touch and we can see if we can help, or if they've been told. There's a lot of sort of well, it depends what they've been told as well. If they've been told at risk and why they're at risk and what to do about it. If they've been given any advice, where were they told this and at what appointment? So in terms of having a conversation, absolutely get in touch, please do.
That's great. And is it more common to have macular disease in one eye or both eyes?
I would say I don't know is the answer. I think a lot of people I speak to have one, but then a lot of people have two. With this condition, it's not one size fits all. People often ask, is it if I have it in one, will it definitely go to the other? Not necessarily. It's just it's not one size fits all at all.
Yeah, so it's difficult to comment. I think one of the questions, please do pop any questions that you have in the chat, or as I say, if you'd prefer, you can use the function of raising your hand and I can invite you to unmute yourself. One of the things I was interested in was, I guess, about how people kind of find out about, support available. So you've obviously mentioned liaison with the eye clinic
Mhm.
coordinators. Does that kind of happen as a matter of course, as part of a pathway that someone would always have to be referred there? Or does it kind of vary dependent on, sort of hospitals, consultants, or
I think it varies greatly. It should be part of a pathway, I think. And it depends. You don't necessarily always get an appointment with the ECLO. The ECLO services is actually a drop-in. So the people based at the RBI, for example, have a drop-in service too. So you can go and just make an appointment on the day, but generally they're referred through after their appointments at the RBI. It's not, I don't think, set in stone about their pathway, but I think it should be because they're really good. They won't always refer to us, and they'll refer to whatever service they think's best. So, for example, Vision Northumberland are a local sight loss charity based in Morpeth. If they feel like they need some sort of support, from them, they might refer to them, or they might, but quite often they'll refer through me as well to if they're newly diagnosed and looking for some information. Yeah.
hope would be, as you say, that kind of pathway
Mhm.
where at least, there's health professionals there,
Yeah.
because it's such a huge diagnosis, isn't it? That
Yeah.
actually to find out that there is support available,
Yeah.
sort of would be quite comforting. There is a couple more questions. So I guess this is around, which you may not know, but there might be some research going into it, why
Mhm.
the incidence of AMD are kind of going up and when rates of smoking are going down.
Mhm. I don't know, but I can find out. But I think in terms of identifying it now, more people are having OCT scans at their opticians, so it's being picked up a lot more, and a lot more frequently. That perhaps it's being picked up earlier than than would have been in the past as well, because they're having OCT scans as a standard part of their eye appointments now and their eye tests. And also, there's been more research coming out recently about genetic links too for AMD. So,
Mm.
if your parents have had it, or that there's more coming through about acknowledging that there is more of a genetic link now too.
So it sounds like there's maybe some research, sort of going into that. I guess there might be a time lapse on these things as well in terms of,
Yeah,
that kind of
yeah,
stopping smoke and having that, sort of health impact,
yeah.
at a
And
later
and
stage.
that's not the only factor really with AMD. It can be lifestyle, it can be diet as well.
Couple more things.
Mhm.
So we have some workers from the Northumberland Stop Smoking Service. Do you find that medical staff discuss smoking and the major risk factor with the disease? So they don't receive kind of any referrals, sort of
Mm.
the Northumberland patients. So I guess that's a question around, I guess what health professionals are
Yeah, what questions they're
suggesting.
asking. To my knowledge, I don't know what's discussed at those appointments, but again, I can certainly, if you were interested or if they wanted more information, I could sort of find out about that or ask people about what they are asked. I know smoking and diet, it will be discussed with them at the time. But for those people, I think that are diagnosed at the opticians and are not referred because they have dry AMD, whether opticians are having those discussions, I'm not sure because an awful lot of people don't forget have dry AMD and that doesn't require treatment and that won't trigger a referral to the hospital. So those people are sort of left, they're diagnosed at the opticians and that is it.
Yeah.
So those people won't get a referral to an ECLO. They won't know where to begin in terms of accessing any information. We do try to work very closely with opticians in terms of making our presence felt. Like, did you know there's a local support group? We try to get them to refer straight to us if that's going to happen. But in terms of those conversations about eye health and smoking, I don't know if they do refer as in, you need to stop this now, we'll refer you to a smoking service. I don't know.
Are your contact details going to be shared after this, Catherine? Your
Absolutely. Yeah.
contact details, and
Yeah.
then perhaps the people who've asked that question can maybe follow up, sort of with yourself,
Yeah.
around that, and whether there's any links to be made there. I think that could be a useful,
Mhm.
sort of contact.
Yeah.
We have another question around. So you might want to read this because I don't know if I
Yeah.
pronounce
That's
it
right.
properly, but diagnosed with punctuate in a. Do you have understanding of
Storage.
this?
Yeah. Yeah. If
Start a course of eye injections on Monday. New to this, but wondered if there's any support or advice available for that.
I don't know. So if this lady or person would be happy to share their details via yourselves, I could get in touch for a one-to-one chat. I think that might be best.
Yeah,
If she's happy with that.
I'll put my email address in the chat, and then anybody who wants to kind of contact me afterwards, I can kind of, yeah, I'll put in contact. So I'll just do that now.
Mhm.
That's great. And oh, we just had someone from the Northumberland Stop Smoking saying that the Lincoln was Newcastle Stop Smoking to see if they're okay for us to send um Northumberland Stop Smoking service contact cards to the Claremont wing at the RVI. I guess that's a way of getting, sort of the details out, isn't it?
Mhm.
Because that's the thing about, sort of living in our, in our county.
Mhm.
People aren't just using services in Northumberland, a
Mhm.
lot of the time. In fact, they're using Newcastle hospitals,
That's
as
right.
well, and obviously the, hospital in
Mhm.
North Tyneside. So, um, we have another question about ethnicity. Does
Mhm.
ethnicity impact the risk of AMD that you're aware of?
Not to my knowledge, but I think there is some, again, research about this underway. So again, I can go and find out. We have our research officers who are, any questions like this, I'll go and email for a more comprehensive answer for them if they'd like.
That's great. So I think, yeah, I've put my email address in there. Please do feel free to, sort of come via myself and we can, sort of get some of that answered. But you are going to send on some of the notes that you've
Yeah,
been
yeah,
working on
yeah.
today, and also all the useful websites. It would be really helpful, I think, to have details of the support groups and where
Mhm.
they are, how to contact, because there will be people on this call who
Mhm.
can signpost, people that they're working with, to these groups. So that would be great.
Okay.
Um,
In terms of the ladies from the Northumberland Stop Smoking Service, it might be worth linking in with Vision Northumberland and BID Services as well. BID Services offer the sort of sensory assessments and they'll offer support too. They're another charity based in Morpeth. That might be worth getting in touch with them too.
what we can do, I say the royal we, probably Tim. Afterwards, when he's sending out all the information, we'll put some links into the other, sort of charities as well, so that people have all of that. So that's fantastic.
It's all right.
Um,
Please do email me any of the questions from the chat and we'll take them away and contact our research officers.
That's great. Has anyone got any other questions? I'll kind of give it a few more minutes in case anything last minute's coming in, or as I say, please feel free to, raise your hand if you'd prefer to ask a question verbally. Thank you so much for coming along today, Catherine.
Right.
It's been really, really useful. And, thanks for giving up your time to come along, and to everybody else. Thank you very much for coming along and really asking some really interesting questions, because sometimes we don't always get questions, so it's been really great that we've actually had such a variation as well. So yes, we've had a few kind of thank yous and stuff as well. So
Okay.
I'll just leave it a couple more minutes, see if
Yeah.
anyone's got anything else coming in. But just to say as well, if you're not comfortable, asking a question, sort of in this chat, I've put my email, sort of address in there. Please come via me as well, and I can put you in contact with Catherine. We will include contact details for the Macular Society more generally in the information that we send out. And do keep an eye out for the future online sessions that we're running. We have one on stammer in December, and we have some booked in for, sort of most of 2025 now. So just keep an eye out on the website for that. We will also send on the recording as well, so that people have access to that and they can refer back to it, sort of at a later date. So thank you everyone for coming along today, and enjoy the rest of your afternoon. Thank you.
Thanks.